Scott Conard, why don't you kick us off?
Fantastic, Mike. Thank you so much. My name is Scott Connard. I'm a family doc, author, kind of healthcare pioneer and physician leader. I'm the founder and physician leader of Go Medical, which stands for Game of Health Medical, a proactive medical home in Texas. I also served as the chief medical and strategy officer of Medical Edge, a healthcare system with 510 clinicians and 1.3 million patients back in 2006 to 2010. Currently, I'm the co-founder of Converging Health, a predictive advanced technology-enabled consulting and services company. And I'm a proud founding member of the board of Primary Care for All Americans. On behalf of the board, I'm delighted to welcome you tonight's Teach-In, Learn-In Zoom session. Thank you for joining us this evening. And with over 1,400 people in 40 states, the District of Columbia, and 350 different zip codes, we're reminded of the incredible momentum we're building together to provide primary care to everyone in every American neighborhood and community. Thank you for your dedication and commitment to expanding access to primary care across the country. Now, it's my pleasure to introduce our moderator for this evening, Dolly Ojo, and to extend my sincere thanks to all of the presenters for tonight's event. I'd also like to thank PC4AA Zoom Committee, as well as John Wright, Patty Armstrong, and Liv Verity for organizing tonight's event. Take it away, Dolly.
Hi, everyone. I'm Dolly Ojo, a family medicine resident at St. John's Episcopal Hospital in Far Rockaway, Queens, New York. I want to start by thanking you all for being here tonight. By joining us, you are helping to build a movement, one that focuses on providing healthcare to people in every neighborhood and community. Primary care for all Americans. If you haven't shared your community yet, please do so in the chat so we can all see who's here as we work together to build this movement. Please continue to refrain from using professional titles. This space is about focusing on the importance of being here together, engaged in this work, and valuing the ideas and commitments that will ultimately drive this movement forward. Tonight, we are here to both teach and learn from each other. We encourage you to contribute by submitting your questions in the chat all through the session. Please stay with us until the end of the session when we'll have time for a Q&A and discussion. We'll explore how you can help bring primary care to everyone in your own neighborhood and community. Now it's my great pleasure to introduce our keynote speaker, Jonathan Busman. Jonathan Busman is a family physician, health benefits advisor, and passionate advocate transforming healthcare delivery with deep expertise in direct primary care and employer-sponsored health plans. He specializes in innovative solutions that align physician-led care with cost-effective strategies. As a fractional chief medical officer and founder of Premed Healthcare, a physician-owned benefits agency, he empowers employers and employees alike, redefining health insurance through transparency, trust, and meaningful care. Take it away, Jonathan.
Thank you so much. Thank you, Scott. Thank you, Dolly. Thank you, Michael, for the invitation. I was kind of trying to figure out how did we end up here? How did Michael get my name and face as part of this discussion? And I have to trace it back through multiple different relationships, and then getting lost at a conference and finding him at a table in a side room, and we start talking. I go, "What is primary care for all Americans? I'm interested. Like, I got to know what you're doing." And he shared the vision of primary care for all Americans and what they had been doing, and the work that he'd been doing in his communities. And I was like, "Oh, totally get this. we actually do this in Oklahoma. And he said, tell me how. What are you doing in Oklahoma? And so that was our introduction. And I got to go back a moment just to introduce where I'm from. I'm in Northwest Oklahoma, and I'm in an Air Force / rural community, about 60,000 people. But I grew up another hour and 15 minutes northwest of here, almost to the Kansas border, almost in the Panhandle, in a little community called Alva. And my hometown was about 5,000 people. Everybody knows everybody. You know, there's one stoplight in town, kind of small town experience. And growing up, honestly, I didn't see a way out of the community. Not that I wanted to get out, but I didn't really see that there were other opportunities outside of the walls of the community. But as fate would have it, as I grew and went on to professional school, I wanted to get back. I wanted to get back to my roots. And my first year in medical school, I had, gotten to know a few people, but still pretty quiet. And I got an invitation that would change my life. It wasn't a lot of money. I kind of jokingly say this $10 probably went further than most people's million. But I had the rural health director from our medical school in Tulsa, Oklahoma State University, Center for Health Sciences, College of Osteopathic Medicine is where I went. And a rural health director called me out, took me to lunch, like I say, spent $10 on me, sat me down and said, hey, we have this residency that we're putting together up in Enid. And I said, yeah, I think I've heard of this. And he said, I want you to look at it. I want you to consider it. Well, I didn't tell him at the time, but I had no intent to go there. I was going to go to Oklahoma City. I was going to do a residency there. And I had my sights set on something else. But he asked me to make a commitment. He said, will you at least do a rotation with them? Do one rotation up there. Check it out. Let me know what you think. And I almost canceled the rotation, but as a man of my word, I was like, okay, I'm going to show up. We'll see what this is all about. And got into the community, got into the hospital, met the attendings, and literally within 2 weeks, I'm driving home, telling my family that we're going to have to move because I want to do residency in Enid. And ended up doing residency in Enid. Again, didn't intend to stay there, but about 6 months into living there, really fell in love with the community and the people, and realized that I'd be crazy to leave it at that point. And decided to stay. I've now been in Enid for 15 years total, 12 years out of residency. Like I say, that lunch was a big deal for me to know that I had the support of our leadership, but also the encouragement to look at the small community, look at a smaller residency. But beyond that, I had applied for and gotten a scholarship for $1,000. Wasn't a ton of money, but it was a super nice gesture by a local foundation I never heard of. It's called Northwest Oklahoma Osteopathic Foundation. I knew nothing of the history. I knew nothing of the organization or its people. But being from Northwest Oklahoma and applying for a scholarship, I won, and I got $1,000. And it was super nice, but that also started one extra relationship with a guy by the name of Steve Whitfield, which was the executive director at the time, who followed me and kept in touch with me all through medical school and into residency, and invited me to events, way to just be kind and in my face at school events or state functions. And lo and behold, I end up in his community. In my fourth year, somewhere along that term of medical school, I was introduced to, at a conference, what at the time was called the Physician Manpower Training Commission. And I really didn't know a whole lot about it other than this is like a rural health focused something. And I looked into it a little bit more and realized that they had a loan repayment program that would offer to me $15,000 a year, tax-free, in loan repayment. And that kind of sealed the deal for me in terms of I'm going to go to rural. I'm going to do this. Like, you got money on the table, I'm going to take it. This is great. And it was an exchange, year for year, $15,000 a year in tax-free loan repayment and a year in commitment. And now again, remind you, this is 15 years ago, actually more than 15 years ago, dollars. And so that accounted for a good portion of my med school cost. So I ended up in Enid, practiced for health system for several years. Actually got recruited to serve on this foundation that had given me $1,000 scholarship. And a couple years into doing this, actually let's fast forward maybe 3 or 4 years into the foundation, I find myself at the helm of the foundation as it's sitting president of the foundation. And we did a strategic meeting, and 2 things happened in that strategic meeting. One was to get started, we did a history. We got out our book and we looked through the dates of this foundation, how it was formed, where it came from, where the money came from, who was involved, and even the leadership over the years. And what I realized sitting in that room was that in 1999, when I was a high school sophomore, there was a group of board members in this foundation that I was now president of that had decided they wanted to get a residency into town. It took them 10 years to get the residency into town. And I graduated from that residency 4 years later. 4 years later, I'm sitting president of this board. Actually, it was 2019. So yeah, 20 years later, I'm literally sitting as president of the foundation that created the opportunity for me in the community that I now serve. It's crazy. It still gives me chills thinking about that. And during that strategic session, I shared the story of this $10 lunch, and we're sitting on a, between $4 and $5 million corpus that we manage. And it's like, what are we going to do with this money? How do we make an impact in our community? And I told them that story, and I said, honestly, guys, I know it takes time, but you guys thought of this 10 years before I ever heard of you. Then I hear of you, and 10 years later, I'm helping lead you. The people that we need at the table, the people we need to know the names of, are our high school students that have their eyes set on medicine. That's where we need to be. And we started forming the idea around how do we develop that program. And here we are. And I'm sorry, they're actually having an event tonight, a hosted event. That's why we have some of my local folks aren't on the call tonight. But that program is now, I want to say, 7 years in the making. I've actually now written letters of recommendation for college students who got into medical school, same letters for those same people to get into residency now. And 2 of those people have already committed to come back to the community when they're finished. And we'll see this whole cycle, now a 10-year cycle, of identifying those people, following them through, supporting them, and seeing them come back to serve the community that once served them. And super fortunate that I've had the mentors that I've had. One of the guys that helped get me to Enid and in residency and became a mentor of mine was actually on the board in '99 when they formed that idea and helped get the residency on board. One other interesting thing is, as Dolly pointed out in my intro, is that I'm doing benefits advising and I'm working with employers. The first self-funded employer I got to work with, and I still have a fantastic relationship with. In fact, they're going to be at Rosetta Fest in Denver, for those of you that are there. But this employer, the second generation owner, who's now retired, this is all a family, it's 4th generation family owned business. He was the president of the board in 1999. 20 years later, as I was sitting on the foundation as its president, I ended up becoming the doctor for this employer through a direct care relationship. So I was literally serving the employees of one of the founding members of this idea 20 years prior. So again, it all comes back to the community and having this circle of leaders who all say, okay, we understand we can throw a ton of money at somebody to try to get them here, but what's the long road, the long game, and how do we accomplish our goals? And that's what our community has been doing. I'd be amiss not to point out more of the efforts, though, of, like I said, was PMTC, Physician Manpower Training Commission. We have since changed the name to Healthcare Workforce Training Commission because now we're helping to supply PAs, nurse practitioners, and nurses, and through many different programs. I have now served 4 years. That's on a governor-appointed commission. There's 3 DOs, 3 MDs, 1 lay member, and 2 nurses on that 9-member commission. The commission is celebrating its 50th anniversary this November, and we are blessed to have our executive director on the call tonight, who I will throw in the spotlight here in a moment. But we have now also since raised the mark from the $60,000 that I received in 2010 to now $200,000 in tax-free loan repayment for physicians who locate to an underserved or rural community. It's kind of amazing to think about that, and I honestly didn't know that even till last week, that I hadn't put it together in my head. It had been 50 years, and I'm anxious to hear Cami, who tells you some of the numbers, some of the statistics of what the state has done in that time frame. But yeah, kind of in a nutshell, that's how I ended up in my community, what the people before me were able to do to provide that opportunity for me to get here, and then how, again, this is a replicable cycle that now I get to be a part of the giving side of it instead of the receiving side. And we're now getting to see generation after generation of physicians placed in our community, and not just our community, all over the state in a similar fashion. One other thing, Michael, I pointed out to you, and I'd forgotten to mention earlier, is for the last, 15 or 20 years, but at least the last 4 we've done an annual fundraiser in the community. It's a single night event. We call it the charity ball. It's a fantastic event. They put on a great show, great event, live auction, and we average over $100,000 in net giving on that single night. For the last 4 years, those monies have been dedicated to physician recruitment in our community. And we've taken that high school, college, med school, residency recruitment approach to the next level, which is to add an additional incentive to come to our community, even on top of what the state is doing. And so it's all been fun. It's all been neat to be a part of. And maybe I'm just 15 years too old to receive these kinds of things, but it's what you get. But super blessed to be a part of each of these entities. I'm going to call you on the spot, Cami. Cami Fullingham is our executive director of the Healthcare Workforce Training Commission in Oklahoma. She's been in that helm for about a year now, but she was with the commission for many years before that as the deputy executive director, and knows the history of the commission very, very well. And Cami, I'll let you take it away. I'd love to hear, I know you have some statistics and a little bit more history on what that commission is, and I didn't want to misquote some of the stuff, so I'll let you tell that story if you don't mind.
That's all right. Hi, I'm Cami. So the commission started 50 years ago. The reason why we were created, we are a state agency, and so we are funded with state appropriated dollars. We were created to fund residency programs in the state of Oklahoma that fell under primary care. For whatever reason, the legislature did not want to pass those dollars directly to the higher ed department. They wanted to make sure that those funds that they earmarked for residency programs went to those residency programs. And so they created us, and we have been funneling half of our budget every year. This year it was almost $5 million that goes to family medicine residency programs in the state of Oklahoma. The other half of our budget, of course, is administrative, but the majority of it goes to those scholarship and loan repayment programs that Dr. Busman was speaking of. We currently sign up on our loan repayment program just for physicians, roughly 50 physicians a year on that. And like he said, they get $50,000 a year for up to 4 years for a total of $200,000 towards their medical school loans. And as we all know, that's not enough to cover most of that, but it helps them, and they're truly grateful for that. And in return, they have to give us 1 year in rural Oklahoma. And so that's been a great program. Like I said, we have roughly 50 that sign up on that program per year. In addition to that, we have scholarship programs that we offer to physicians, PAs, nurses. We don't have quite as many that want to sign up on that, because a lot of times they don't know while they're still in training where they want to go work, and they don't know that they want to make the commitment to rural Oklahoma. For some of them, that's a large jump. Some of them, it's not. But usually we have about 10 that commit to going to rural Oklahoma once they finish their residency. But overall, we've been going through records trying to figure out about how many we've helped just over the last 20 years. And it's about 1,500 that we've been able to help. And I don't have dollar amounts on that because that has fluctuated. We didn't keep tally of those amounts, and those programs have changed. Like Dr. Busman said, there was sometimes that we were giving $15,000 a year, and now we're up to 50. And so those dollar amounts have changed throughout the years. Programs have come and gone. But it's been millions of dollars that we've been able to help these physicians get out of debt from medical school and be able to help those in rural Oklahoma, which is a huge need here. I'm sure it is across the whole nation, but we know what it is here for sure.
And Cami, one thing that I think we should highlight too is that we don't do this alone. So these are not all state dollars. These are done through partnerships. And so every loan repayment includes two partners. One is the community sponsor, which is almost always going to be either an FQHC, a health center, hospital, large clinic, something of that nature. We do have some private partnerships or private clinics that will be the sponsor. And it's not exactly a third, but it's pretty close, in reason of close. And then we have we have three other larger sponsors. One is Blue Cross Blue Shield of Oklahoma. One is TSET, which in Oklahoma is the Tobacco Settlement Endowment Trust, which is a big lawsuit and we won with the tobacco industry, and those monies went to many, many different places, but we're recipients of that. And in fact, they're our largest of the three. And then the other one is the Oklahoma State Medical Association, the MD's state association, who has also received some monies through the years for settlements and such. So they've helped to do a lot. And so that it really is a multi-pronged effort anytime this happens. What I will say, and it's not like we're just handing out money. What happens is Cami and her team get interested parties, interested physicians, and they interview them. And they find out where they're from, where they want to go, what they've been doing, what their motivations are, what their spouse does, if they have a spouse, how many children they have. They really get to know them, get to know that this placement is a placement that's going to be good for them, that we can stand behind as a commission. Ultimately, the commissioners sign off whether or not we give away those funds. And granted, by the time they get through the process through our agency, they've been vetted very well. So many of them do get it. We haven't quite reached a place, and we think this would be a great thing if we do, but we haven't really reached a place where we just have to say no because we've had too many applicants. We've got enough monies set aside that we're doing okay with that. I think that would be a great problem to have. And I think any community would be happy to have that problem. But that said, we've had great placements, and our commissioners, not all of them, because not all of them are even eligible, but I would say the majority of our commissioners are actually recipients at one point in time as students or residents or new physicians of the commission dollars, which is pretty neat. Again, getting to go back and serve the commission that served us.
Yes, and we're also reaching out like you are to your high school students in Enid. We're doing that locally here as well in Oklahoma City, as well as in Tulsa. In fact, Friday I spent at OSU trying to reach out to not even just high schoolers, but as far back as junior high and even some grade school. So we're also kind of partnering with you there and doing that, knowing that we need this need to be filled. We need to reach out to people, to students younger than high school even. So we're doing more than just handing out dollars. We're going to speak to medical students. We're speaking to residents. We spent our days are very full having lots of conversations with multiple different people.
Absolutely. And I would say one of the greatest successes on the local level is we've got really a great group of local physicians who are willing to take in college students who are pre-med to shadow. And our foundation kind of becomes that known place to go, you know, like, hey, if you need help, if you want to know how to get into med school or who you need to know or what things you need to know, like get to know these people, right? They're going to get your back. And so that in some ways that vetting process is taking place long before they ever get to the med school interview, which is totally fine. We're preparing them. We're making sure they understand what they're getting into and making sure that they're prepared when they get there and supported when they get there. It's a huge thing.
Thank you guys so much. This is incredible. I've been watching some questions pop up in the chat and even thinking through some of these questions here of, you know, how are we getting started with a process like this and what does it look like? It sounds like with a multi-pronged approach, there's really so many options of where to get started. But one of the first things that we look at, or I guess I would have a question on, is do you start with the loan repayment piece from the state level or from the local community level? Like in your process, or do you just throw spaghetti at the wall and see what sticks?
I mean, I think the efforts are in most ways synergistic, but it's not like we're working like as partners in strategy or coming up with our programs. So the state has its programs. I mean, this is legislature. I mean, it's in statute, right? It's statutorily funded. Of course, we go back and ask for increases like any other good agency would do. Hey, we're doing good. Give us more. We're going to do better. And we've been able to do that. We actually, not that we really get to spend this money how we want by any means, but when ARPA was passed, our agency was chosen as the state agency to manage the ARPA funds, which took our budget from about 9 million to 90 million in, a month. And so that was a big change for us. Now, granted, all those monies were already earmarked, but they trusted our agency because we'd managed funds appropriately, and they knew that the ARPA funds were really geared around trying to build up the workforce. And that's actually why we changed the name from Physician Manpower to Healthcare Workforce Training Commission, is because it's broader than just physicians at this point.
That makes sense. And I think, one of the other things that I heard you talk about was scholarships with obligations attached to it versus loan repayment. Do you find one of those two to be more successful in your process that you follow?
They're kind of one and the same to me. So it is a service obligation. So they're required to be full-time physicians in the community and live there. That's the other thing, is they must live in the community. You can't be a commuter living in the metro area and driving out town. We want you to be embedded in the community. And that's one of the things that the commission and our agency staff does when they vet these applicants is, where are you going to live? Like, we need to know, like, what's the address? Where are you locating? So these are very important things. And there have been times, thank goodness rare, but there have been times where we've had to cut the funds and say, if you're not going to move out of Tulsa, I'm sorry, you're not eligible for these funds. And we've done it. We've done it for folks in Oklahoma City. We've done it for folks in Tulsa. And one of them skirted under the radar for a while, but basically, we have an assistant attorney general in every one of our commission meetings. It's an Open Meetings Act, Open Meetings Commission. We are very, very by the book. We are a state-run agency, and we have to be. So I feel like our checks and balances are really, really strong. But that's also, again, on the agency to vet our applicants very well.
Yeah, so in terms of the applicants, I know that you were mentioning like right now you're not quite at the point where you get to turn people away yet. But as you go into some of these younger and younger age groups, right? So when you go to meet with students, where are you starting? Do you start with school superintendents? Do you start like who's your initial point of contact that then you're able to actually do these meetings? And are you meeting with like the science crew? Are you meeting like doing full presentations? Is it more intimate group?
Got the question.
Yeah, that's a fantastic question, and the answer is all of the above, because it depends on the school district, it depends on the size of the community, and it depends on who the champion is in that organization or that school, because sometimes it's going to be the science teacher who's taken a special interest in it and kind of puts those students under their wing and wants to be the ones to promote it. Sometimes it's the counselor. Sometimes it's the principal. You get into these really small schools, it's the principal. What we have found is if you can coordinate some of those meetings with the schools and bring in a physician over lunch, or something of that nature, bring somebody in who tells a story similar to mine where, hey, I grew up in this area or grew up rural, I came back, look at me now. Look, I never thought I'd get off the walls of this community, and look, here I am 20 years later. So it's good for them to see that, because I can attest to this myself. I don't know of the other physicians on the call, but I know when I was a high school student, I did not believe in myself until someone believed in me. And my personal story on that is my now mentor and friend, and funny enough, now patient at 78 years old, retired neurosurgeon. At 16 years old, I was a catcher. He was the pitching coach in summer league. And I approached him after a baseball game one night, after my junior year, before senior year, and told him, hey, I'm thinking about being a physician. I was curious if I could pick your brain about what I should be doing or what I could do to maybe achieve that goal. And his first words to me, he said, I can't imagine someone better than you. I can't imagine. And he said, I'll do anything I can do to help you. And that was a year before college. I called him up after a week in college on a Thursday. On Friday, I get a call from his CFO and said, hey, Doc says you need a job. Why don't you be here on Monday? And I look back and I think, man, that $7 an hour was the best money I've ever been paid. Best money ever, because I got to learn from some of the best. I saw private practice. They literally had me, when people ask me, how did you end up becoming a broker or a benefits advisor? Well, at 18, I got paid $7 an hour to file claims. And I learned how to file claims via paper, and I learned how to file claims via whatever that MS-DOS-like program was, green screen. So like I've known this billing process, the coding, the allowables, the EOBs, the audits. I've known all this stuff for so long. In fact, it led me to actually change. One of the neurosurgeons there told me, you need to get a liberal arts education. There's nothing special about you. And that wasn't real nice, but that's what he said. And I went and got the liberal arts education in political science and wrote my senior paper about the rising cost of healthcare and all the various reasons why that was happening. And I got it completely wrong looking back. But the fact of the matter was I was digging, and I was curious, and I knew that it was broken. I was just trying to figure out the brokenness and where it was. And so that really, again, my head was wrapped around that space for a long time. So fast forward, there's no surprise to anyone who knows me that I ended up going independent. There's no surprise I'm doing direct care. There's no surprise I'm doing benefits advising or the things that I'm doing, because that's really where I've been. That's the headspace I've been in for so long. And really, it's just a matter of saying, I don't think the status quo is good enough. I think we can do better. And where you see a problem, you can complain about it, or you can step up and do something about it. Those are your two choices. And there's nothing magical about stepping up and doing it. You just got to show up. And that's what one of my mentors, the guy I referenced earlier, that helped me get to Enid, I served on our state association board per his push. And I asked him before my first board meeting, I was like, what am I supposed to do? Like, give me some ideas of what this means. And he said, I'll tell you what to do. Show up, shut up, listen, and learn. Go from there. I was like, okay. Seemed stupid at the time, but those are some of the greatest pieces of wisdom he could have given me. Like, show up. That's the first and biggest job you can achieve. And then be quiet, listen, learn. It's okay. Just keep listening. So that was really funny but great advice.
That's awesome. And I think, aligns so much with what we are all about here at PC4AA. Michael, I don't know about you, but I see your little box up in the corner and you are grinning ear to ear right now. It sounds like this is exactly the thing that we have talked about over and over again. What do you think?
I mean, Jonathan, I don't know how to thank you enough for your wisdom and your humanity and your decency. You are kind of a teacher for all of us. And for all of us, there we have it. I mean, states and communities can make a huge difference in developing primary care workforce, but it doesn't come from someplace else. It doesn't come from the Capitol. It doesn't come from Washington. It comes from what that neurosurgeon did with Jonathan. It's something that I find myself doing when I'm seeing patients, and I find a kid who's somewhere between 13 and 15 or 16 who I can tell is bright. I'm recruiting. The first thing that comes out of my mouth is, we need you to go to medical school, and then you need to come here and practice with us. Because I think that's the way we build this up. We got to do a whole bunch of other stuff, and the financial modeling, this notion of $50,000 a year in loan repayment, which is enough to make a difference, matters a lot. But the point is that by acting locally, we can ensure that more of our students choose medical and nursing careers, and choose to come back and practice in their own communities and our own communities by the way we model this. And when more people choose, then more medical residencies at least will fill with American graduates. Most people don't know that 25% of everybody practicing in the United States, every physician practicing in the United States, was trained in another country. We have something like 66,000 applicants to medical school a year, 22,000 get in, which means 44,000 don't. We got to do this differently so we get our own kids from our own communities into medical school and into residency, and then bring them back to those communities. And we're only going to do this working together, and by working together in our own communities. And that's the only way we're going to address the huge workforce problem in primary care, which is huge, and is a rate limiting step for both public health, for community health centers, for DPC, for everybody. But the only way to do it is not to wait for the cavalry to come. It's for us to do it together. So please step up, start or join a local work group, talk to those kids who are bright, and say, we need you. You can do this. Exactly what that neurosurgeon said to Jonathan. You can do this. I talk to lots of people I know who's smart. You're smart. We need your help. So, do that, start that work group, join a work group, and please do it today.
Thank you, Michael. One of the things that's been really encouraging is some of these students come from low-income, underserved areas themselves, and many of them are children of or grandchildren of immigrants or Mexican immigrants, a lot of them. And it's so good to have the conversation with them. And everyone, there's 3 of them either getting into school right now. We have one that's a couple of years away. That I'm like, our community needs you. When we look around the community and think about who we're serving, like, your community is underrepresented. Not just our community, your specific community, your demographic is so underrepresented. and to be able to empower them to know that, hey, you're going to have support, and money is not going to be what holds you back from being able to pursue a dream like that, because you're going to have a community and a state behind you to make sure that you can go back and serve your community well.
Exciting discussion we've had tonight. What is also exciting is that in 3 weeks, we'll be meeting again. We encourage every one of you to invite someone to get involved in our movement. Mark your calendars for our next Zoom meeting on August 5th, when we'll be hearing from Len Frommer about leveraging market forces to bring primary care to all Americans. We look forward to seeing you then and there. Register on our website at www.primarycareforallamericans.org. There you can also check out our local and state playbook. You can volunteer and donate to support our cause. Now I would like to introduce Lindsay Lopez, our social media lead, who will help everyone understand how we can all use our social media to help bring primary care to everyone.
Hi, everyone. Just a quick reminder to follow us on social media if you haven't already. It really helps us grow our movement and connect with people we might not otherwise reach. So every like, comment, share, tag, honestly, any interaction helps more folks learn about what we're doing and why it matters. We're talking about real wins and progress from our local work groups around the country, Central Falls, Rhode Island, New Bedford, Massachusetts, Queens, New York, and more. We report on primary care stories and developments around the nation. So any trending news, and we also post clips from events like this one, where community voices and experts come together to spark change. So if you missed Teach and Learning before, you can look back on our YouTube to see the videos and also share short clips on our socials. So if you're passionate about making healthcare better, more fair, more human, follow us, stay connected, and help spread the word. I'm going to drop the handle link in the chat right now so you can follow and share. And thanks again, everyone, for being here and being part of this with us.
Thank you. Thank you, everyone, for joining us tonight. We appreciate every one of you for helping us to spread this movement across our nation in order to get the change you deserve. Please take a minute to complete our survey. The link is in the chat. We want to hear from you. And if you would like to talk more with members of this leadership team, stay back on the call, and our board members will stay on to hear your feedback to help us grow as a community. Thank you, everyone. See you on August 5th.
And thank you, Dolly. Thank you, everyone. Great presentation. Anybody have questions or thoughts? Donna asked if anybody had noticed that there are going to be no more loans for health professionals for, I think it's more than $150,000.
Well, that's when you talked about the we reimburse loans, they're not going to be available anymore for them to take unless they get private. But they'll be up to, I think, 150 for docs or something. And for the 4 years, all 4 years, not per year. Plus, then they have an undergrad. So paying back when they would have to have good enough credit to get private loans. It's I'm an educator, so I'm really bummed about this whole thing. I don't know how you make more doctors and whatever. I just don't know how. Unfortunately, it's just more, the people who can afford or who have something to put up as collateral to get loans or have the credit or whatever. But I was reading such a sad thing in one of the doc journals today from a first generation Texan who had worked his butt off to get through undergrad, only wanted to be a doc and only wanted to was working to live and was taking out loans, of course, and then then just found out there's no way he'll ever even get to like year two on the new what. So I don't know. It seems like a new. I don't
Well, but Don, I think that's the point of some of the work we're doing at Primary Care for All Americans with local work groups. It's pretty clear that this isn't going to come from the federal government. Once upon a time, there were 1,800 National Health Service Corps scholarships a year. Now there are about 50. The stuff from the federal government isn't going to sustain us, but that means that it's time for communities and states to step up and do what they're doing in Oklahoma. Oklahoma's not being limited by that because they've raised the money themselves. And that's kind of what
paying
we're all
back,
going to have to
but
do.
paying back means you have to take it out first. So paying them along the way as they go to school would be the only way to do it. You wouldn't be able to say take out a loan and get it back. These are people that couldn't get loans.
And that may well favor scholarships over
Right,
loans over
right,
time.
right.
I had a National Health Service Corps scholarship, and I suspect a number of people on this call did as well.
Right.
That's why I went to medical school. And I suspect for first generation families, scholarships are going to be more helpful than loaner payment, particularly as the upper limit has changed. Other thoughts or ideas about how you put this together locally? Jonathan, tell us a little bit about that fundraiser that raised $100,000. Who puts that together? Who organizes it? And who makes it exciting and fun so everybody shows up?
Yeah, so it's actually our local foundation that organizes it. Originally, the first, I don't know, 12, 15 years of it was for a local community clinic, free clinic. And that's where the proceeds went. That one event paid for everything. Everything was volunteer service, but as far as keeping the lights on and having supplies and such, it did that. But yeah, it's just a committee that's formed actually by community members. Many of them we only have maybe 2 foundation board members that are on that committee. The rest is community people who like to have fun and know how to make fun events. And then invitations go out to our business leaders. We actually have 2 hospitals in our community, but both hospitals sponsor. This year we have both hospitals and the FQHC, who's actually hosting our newest residency that we have. So we have those sponsors. And then live auction is always fun. So just getting people out, that's the big thing. It's a nice summer event held at the country club. It's a good time, and people look forward to it.
How many people come?
On average, we have about 160, 150, 160 people.
That's not terrible. Sounds great. Anybody have other experiences doing local fundraising like that? My guess is a lot of us are about to start learning. I think in New Bedford, they're talking about golf tournaments. And all I can say is Bedford is glad that I don't live there because you don't want to see me play golf. Anyway, anybody have any other thoughts or questions before we close? Well, let's give Jonathan a huge round of applause and Dolly a huge round of applause. Thanks to everybody for being with us. We'll see you back on August 5th. Have a wonderful summer and get some rest.
All right.
Thanks, everybody.
Thanks for having me, Michael.